I feel a little spoiled. Meadows Surgical Arts, that's the name of our practice. I am in Commerce, which is about 35 minutes or miles away. Now we all know that this is Northeast Georgia, so we always say it takes 30 minutes to get there, but the reality is there are a lot of twists and turns sometimes between here and there. The practice in the building sits right across the street from the old pottery, or right next to Walmart if you're looking for landmarks down there. Sonny's Barbecue, also, right there on Highway 441. The Sonny's, the Home Depot, and the Walmart are very nice because when we have husbands or other family members who are trying to figure out what to do while their wife is there. See, I see some smiles. Some of you guys have made that trip. So, anyway, that's where we're located. Molly, hey, can we bring this back down just a little bit? It looks like a lot of our slides are going to be sitting a little bit high. Yes, I am the medical director of Meadows Surgical Arts. I'm board certified in both cosmetic surgery as well as gynecology. Some of the fun, fluff stuff that we do. We have a full-on medical spa that offers everything from massages, microderms, just kind of a nice place to go and get away and relax for an afternoon. But also some more aggressive treatments if you're trying to get rid of sun damage or a few wrinkles. We do Botox. We do a lot of Botox. We are actually one of the few people in the area that achieved gold status with Allergan, which is a company that makes Botox. That says two things. One, we do a lot. Two, we're very well trained. So this is actually a friend and patient of ours that has been treated with Botox. And these are the 11 lines that Allergan, the company that makes Botox, spent a lot of time marketing over the last few years. Another friend and patient that's had essentially a liquid facelift. If you've heard or read about the liquid facelift, it's a combination of using Botox and fillers to rejuvenate the face that doesn't require surgery, doesn't require going to sleep, and in many cases really doesn't require any or certainly not that much anesthesia. We were putting these slides together a couple of days ago. That's great, Mom. Thank you. Still, you're just going to have to hold this. No, that looks good. Okay. We're putting slides together. Anybody want to venture a guess how old she is?
22.
22. Yeah, I understand. My answer is younger than me. 43, which it's a great looking result, and she's a pretty girl. So, laser hair removal. We've been doing this for about 8 years now. Obviously, this is a very severe case and a nice result. Permanent makeup. And if you can't tell, this is really the difference here. Yeah, exactly. Fractional CO2 laser peel. This lady came to me, and this is another funny story. She came to me with the sun damage that she had here. And this was taken after she had her procedure done. She was down for some Botox one night. And we were sitting, visiting with her, and I pulled up this picture, because I knew she hadn't seen it in a while. It had probably been about 3 months. I said, "Do you know this lady?" She looked at it for a minute. She really genuinely had to look for a second or two before she realized, that's me. So, and we honestly get that a bit. Cool sculpting. I know there are a lot of patients that are here, that there are a lot of people that came out tonight to specifically find out about this. I'm going to talk for a few minutes about it. In the 1970s, researchers at Harvard actually looked at kids that were losing fat, small kids that were losing fat in their face, trying to figure out what's going on. What they realized is they were getting what's called popsicle paniculitis. Literally, it meant they were sticking the popsicle inside their mouth, freezing those fat cells in there, and winding up with these divots on each side. Well, that research, okay, great, neat thing to find in science, and it just got put to the side from the 1970s until the last few years. And at this point, what we're doing is taking that same concept, that same technology, where literally we wind up pulling an area of fat up into the machine, and over an hour's period of time, it winds up freezing that fat to the point that over the next 2 months, fat goes away. It's actually one of our employees here. Additional medical spa treatments, laser tattoo removal. There was a blog on Facebook that we did a few weeks ago about this. Laser vein treatment. I'm going to talk a lot about our laser vein treatment here in a few minutes. Brown spots, microderm, facials, and massage. Intravenous laser ablation. As a gynecologist, I had a lot of patients. They'd had their babies and worked. A lot of school teachers and people that were on their feet a lot. They came to me and they had laser, they had bad veins, painful legs, restless leg at night, and they wanted help. In fact, before fellowship, really, it was injecting them sclerotherapy, treating them with a laser, and that was mostly just for the spider veins, or vein stripping, which is a fairly barbaric procedure where we make big incisions here, there, marching down the leg, and they would literally go in and pull these veins out. Again, it was barbaric. So intravenous laser ablation came along, and now all we have to do to treat those veins is a small needle puncture down here at the knee, go on the inside of that same vein that's a problem. The laser winds up treating the vein from the inside, so you don't wind up with all those cuts and the big procedure. Insurance pays for it. You go home the same day. Downtime is essentially nothing. I've got a nurse that had done work the next day. I don't have any employees that I can pick on tonight, but basically it's no downtime. This is what we're talking about. You see the big bulging vein here. These patients usually, one, it's unsightly, but two, they usually have pain. And it's funny because a lot of times we'll treat it and they'll say, well, the other leg's not that bad. And all of a sudden their leg feels so much better, and I'm like, okay, fine, sign me up for the other one, because I didn't realize just how bad it was. Here's why it is the way it is. A normal vein has valves that are supposed to push the blood back up. Every time we take a step, massages the vein pushes the blood back uphill. The valve closes and keeps the vein from backtracking. Unfortunately, either childbirth, anything that damages these veins, people that are on their feet for a lot, people that are big runners can have the same type of thing. The first valve leaks. Well, when the first one starts leaking, then all of a sudden the one below it's having to carry twice as much pressure. Well, guess what? That one blows out, and all of a sudden you wind up with this, usually at the bottom. And a lot of times when you start seeing these, they're usually down here, and then eventually they march their way up, and until they either get treated or it just gets worse, you'll see them all the way up here into the thighs. Trauma can cause it as well. I had several gentlemen that I treated towards the end of last year that had horrible vessels like this going all the way up their leg. Another gentleman, guys usually have the most impressive veins, but on the other hand, it's hard to get them to shave their legs for the pictures. Another one, this is actually a picture from my friend Dr. Oberhelm that's here with me this evening. She's spending the next year with me learning and training, but she does a lot of these vein procedures out in Kansas. And this is kind of what happens. Here's your chicken, there's the egg. You see the type of problems that they have. And the nice thing is, you see the big ropey vein here, and you can see it's gone. This is one of the two guys I was talking about that I treated towards the end of last year. Big venous stasis ulcer. Nice guy, and he's probably my age, maybe a year or two older than that. Has a landscaping service here locally, and if he's out weed eating, doing any type of work, and his leg gets even dinged a little bit, this thing was pouring blood, and he had to go home for the day. So we treated him, and you see the big bulgy vessels he's got all around here. Now, you say, well, wait a minute, it's still brown. Absolutely. That staining happens because these vessels, these veins, are just leaking blood out into the skin all day long, and it literally stains or tattoos the skin. So over time, the staining will get a little bit better, but the important thing is he doesn't have those big ulcers anymore. Cosmetic surgery. Yes, absolutely. I was here as an OBGYN for 10 years and had grown a cosmetic surgery practice. I had so many patients that, through the years, well, while you're doing my hysterectomy, can you do a tummy tuck? Or while you're doing my hysterectomy, can I get some liposuction? So little by little, I grew this cosmetic practice, and finally I said, enough is enough. If I'm going to continue to do this, then I'm going to go, take a year off, shut things down, get the board certification to legitimize what we're doing. So that's how I wound up from, what do you mean you're a gynecologist and this? So that's how I slide there. This patient of mine that we did not long after I got home. And you see there's a pretty big difference between what her belly used to look like and how nice and flat it is now. Liposuction for this patient. She had smart liposuction. Smart liposuction takes a laser, puts it underneath the skin. What that laser does is the same thing as if you take bacon and put it into a hot frying pan. It shrinks. That's what happens with the skin when you're using that laser underneath. This is probably the most impressive photo of the night. It hadn't been touched. That's legitimate. This girl, she came to me. Her birthday was coming up a week or so later, and her husband wanted to do this for her for her birthday. So it's a great result. Obviously, I've used it other places for marketing. So anyway, happy patient. Really nice result. She did, and she lost it the old-fashioned way. It wasn't gastric bypass or anything else. You just, less calories in, more calories burned. Facelift result. This lady came to me because she was really bothered by the turkey neck that she had hanging down here. We did a lot of things for her, but that was really her priority. You can see that's pretty much gone. Her neck's nice and tight afterwards. Another lady, she was really bothered by the fact that her cheeks had kind of fallen, and you see kind of what she's got going on with the lines around her eyes and the big bulge that she had underneath her eyes. She was a little bothered by the wrinkles down here underneath her neck, and very happy patient. This lady, 70, wait, don't let me get it wrong. How old is she, Catherine? Because I always accuse her of being older than she really is.
74.
74 or 5?
4.
Okay. Came to me, but she didn't like these bulges over her upper eyelids. And you can see those are pretty much gone afterwards. Yeah, it's something to do a lot, particularly this time of year. This little girl came to us, she's 7 years old. She was just getting to the age that kids were starting to bother her in school, starting to pick on her and give her a hard time. That's what she had before. And you can see there's a little bit of difference. This one sticks out further and rolls out a little bit more. And you see afterwards, they're pretty darn similar.
Yeah. 7 years old.
Yeah. We do a lot of other cosmetic procedures, rhinoplasties, neck lifts. We do a lot of things. I did not want to overwhelm you guys or put dinner off too long this evening, but I think you see from seeing the pictures here, we do pretty much full spectrum of cosmetic surgery down here and get some pretty nice results. Thank you guys so much for coming out this evening. Enjoy the meal. We will be here to talk to people, answer questions, do consults. If anybody came out this evening wanting some Botox, we are prepared to do that, but not anything beyond that. So don't feel pressure.